Pop up now.
Hello, good morning, everyone. We're just waiting for a few participants to join.
Good morning.
We'll start in next 5 minutes, please.
Good morning, sir.
Take a deep breath. Hold it. Now exhale. Again. Hold it. Exhale. Again. Take a deep breath. Hold it for 3 seconds. Now exhale. Do it 2 more times. This is a stress-free technique. Whenever you're stressed out, whenever you're in the middle of work, whenever your brain is frozen, whenever you don't have the solutions, just sit relaxedly, take a deep breath, hold it for 3 seconds, and then exhale. Don't open your eyes yet. Sit relaxedly. Concentrate on your breath. This is called mindfulness. Mindfulness is a technique to make your muscles relaxed, to make your body and soul relaxed from the stress. Do one more time. Take a deep breath. Fill up your tummy with the air. So your tummy is pushing out. Hold it. Now exhale. Take your palms and rub it out. Take your palms and rub your palms so that you feel the warmth, and then put the palm onto your eyes. Put the palms onto your eyes. You should feel the warmth of the palms. రెండు చేతులు రబ్ చేసి ఆ వేడిని మీ కళ్ళ పైన పెట్టుకోండి. 3 to 4 times చేయండి. Relax your body. Now slowly try to open your eyes. Right. Take your time, no issues. I hope my voice is audible to everyone. Okay.
Yes.
Right. So today's topic is sleep, hormones, and blood sugar. I could say this is the lesser known triangle in the glucose control. I tell you why. Many people think blood glucose levels is only about physical activity, taking tablets on time, maintaining little bit of diet here and there, exercises, gymming, swimming, running, jogging, or not taking stress. Yes, exactly. But yes, today's session sheds some light on the powerful but often overlooked triad, which is sleep, hormones, and blood sugars. Poor sleep doesn't just make you tired, it affects your insulin, it affects your hormones, it affects your cravings and glucose levels. మీ poor sleep ఓన్లీ మిమ్మల్ని టైర్డ్ మాత్రమే చేయదు, ఇన్సులిన్ని, హార్మోన్స్ని, క్రేవింగ్స్ని, అలాగే మీ గ్లూకోజ్ లెవెల్స్ని చాలా ఇంపాక్ట్ చేస్తుంది. Why sleep matters in diabetes, or why sleep matters in weight loss, why sleep matters in weight management, why sleep matters in PCOD, why sleep matters in gestation diabetes, why sleep matters at all. Because the sleep is the body's reset button. Inadequate or disturbed sleep, both wise, what happens? It increases the insulin resistance, it elevates the morning blood sugars, it triggers the cravings for high carb sugary foods. It also increases the stress hormone, which is called cortisol levels. So let's see what are the hormones that are linking to sleep and blood sugar. Because if you get to know about this, you will start seeing a lot of changes happening to your body in very short span of time. అంటే మీ శరీరంలో జరుగుతున్న చిన్న చిన్న మార్పులు చేర్పులు ఈజీగా చూడడం స్టార్ట్ చేస్తారు. ఓకే, నా స్ట్రెస్ పెరుగుతుంది అంటే ఈ హార్మోన్ పెరుగుతుంది అనమాట. మై స్ట్రెస్ ఈస్ గెటింగ్ బిగ్గర్, సో దీస్ ఆర్ ద హార్మోన్స్ దట్ ఈస్ ఎఫెక్టింగ్ మై బాడీ, ఈస్ వాట్ యూ గెట్ టు నో. So there are 5 hormones that you mostly need to know. First thing is cortisol. Cortisol means it's a stress hormone. See, the effect of sleep deprivation stays high if your cortisol is high. And if your cortisol is high, the blood glucose sugars will become high. So the impact on sugar is also high. Next is insulin. Insulin is produced by our pancreas. It becomes less effective because sleep is deprived.
Your voice is cracking, sir. I think it is the problem. I have checked my internet is okay. Your voice is cracking. For the rest of us, you can please check 1 second.
No,
Yeah,
we
is
can
my
hear
voice
properly,
okay?
sir. We can hear properly, sir.
Thank you, problem. So yeah, so just make sure that you switch off my video so that you can only listen to my audio.
Yeah, okay, I will try.
Yeah. So insulin becomes less effective. So when insulin becomes less effective, so the produced insulin also doesn't work. So the rise of resistance becomes more and more. That is what is called as insulin resistance. So మన శరీరంలో ఈ ఇన్సులిన్ ఎఫెక్ట్ చూపించడం చాలా తగ్గిపోతుంది అండ్ ఇన్సులిన్ రెసిస్టెన్స్ పెరిగిపోతుంది. చాలా మందికి తెలియని 2 హార్మోన్స్ ఉంటాయి. వాటి పేరే లెప్టిన్ అండ్ గ్రెలిన్. సో హౌ మెనీ ఆఫ్ యూ నో వాట్ ఈస్ లెప్టిన్? So leptin, I'll tell you. So leptin is a hormone generally produced by our fat cells that crucially plays a vital role in regulating appetite, energy balance, and body weight. So it actually acts directly onto the brain to signal satiety. Ante, if let's say for example, if I'm eating 1 bowl of poha, okay, so it sends the signal to the brain that you know how much food is consumed and how much energy is expended. When leptin levels are high, it should signal to the brain that the body has enough energy, potentially decreasing the appetite. So point is, it should give a signal that, okay, now it is enough, your energy is full, you should stop it. So this leptin resistance can occur where the brain becomes less responsive to leptin, leading to increased appetite and overeating. సో ఎప్పుడైతే ఈ రెసిస్టెన్స్ జరుగుతుందో బ్రెయిన్ కి ఆ సిగ్నల్ వెళ్ళేది తగ్గిపోయి లెప్టిన్ జనరల్ గా మనకి ఏం చేస్తుందంటే మన తిన్న ఫుడ్ లోంచి ఎనర్జీ బాగా ప్రొడ్యూస్ అయింది, సో నువ్వు తీసుకునే ఎనర్జీ చాలు ఇంకా ఆపేసే అన్న సిగ్నల్ పంపిస్తుంది. సో ఈ రెస్పాన్స్ డిలే అవటం వల్ల ఈ రెస్పాన్స్ సరిగ్గా లేకపోవడం వల్ల ఇట్ లీడ్స్ టు ఇంక్రీజ్డ్ ఎపిటైట్. అంటే ఇంకా నాకు సరిపోలేదు. అందుకనే when we watch a mobile or watch a TV and eat, the response is very low. The leptin response becomes very low because your brain is getting entertained and it doesn't differentiate whether it is getting entertained or whether it needs to satisfy your satiety. అంటే మీ కడుపు నింపుగల తత్వం ఏవైతే ఉందో దాన్ని మనం సరిచేయాలా లేకపోతే ఎంటర్టైన్ చేసుకోవాలన్న దానికి డిఫరెన్స్ ఉండదు. సో డెఫినెట్గా ఈ ఎఫెక్ట్ అనేది మీ బాడీ మెటబాలిజమే చూపిస్తుంది. ఇట్ ఎఫెక్ట్స్ యువర్ మెటబాలిజం లైక్ వెరీ మచ్. సో డెఫినెట్లీ యువర్ స్లీప్ ఆల్సో డిక్రీజెస్ అండ్ యువర్ హంగర్ ఆల్సో ఇంక్రీజెస్. నెక్స్ట్ ఈస్ గ్రెలిన్. సో సిమిలర్ థింగ్ ఈస్ గ్రెలిన్. సో గ్రెలిన్ ఈజ్ ఆల్సో ఏ హార్మోన్ వేర్ it is produced in the stomach, okay, that plays a key role in regulating appetite and food intake. It is called as hunger hormone because it signals to the brain to increase appetite and initiate feeding. So first, leptin is what? It gives a signal that, okay, now it is enough, you have to stop it. But ghrelin, what it does is, it increases your appetite and it initiates the feeding. So leptin and ghrelin should always be balanced. Okay, so in the brain, ghrelin causes a hunger response, driving you to seek food. For example, when ghrelin increases, you can't be like sitting, you have to eat something. That is the work of ghrelin. It also causes a stomach to prepare for food, and stretching the stomach with food stops the release of ghrelin. So whenever our stomach is like stretched out, because you are feeding and the stomach is stretched out, then the ghrelin production stops because now you are full. Okay, మనం తిన్న తర్వాత ఓకే ఇనిషియేట్ చేసింది, తినాలని ఇనిషియేట్ చేసింది, తినేస్తాం. మనం తినేసిన తర్వాత ఓకే నాకు ఫుల్ అయిపోయింది, స్ట్రెచ్ ఎప్పుడైతే అవుతుందో స్టమక్ మనకి ఇట్ ఈస్ వెరీ స్ట్రెచబుల్ ప్యాకెట్ అని చెప్పొచ్చు మనం. ఇట్స్ లైక్ అ పౌచ్. ఆ పౌచ్ ఇలా స్ట్రెచ్ అయిన వెంటనే ఒక్కొక్కరికి ఒక్కొక్కలా స్ట్రెచ్ అవుతుంది. కొంతమందికి ఇంత స్ట్రెచ్ అయితే సరిపోతుంది, కొంతమందికి ఇంత స్ట్రెచ్ అయితే సరిపోతుంది. సో ఫర్ ఎవ్రీ వన్ దిస్ గ్రెలిన్ హార్మోన్ ప్రొడక్షన్ ఇస్ డిఫరెంట్. ఫర్ ఎగ్జాంపుల్, for me, if I eat 3 dosas, it is satisfying for me. For some people, it is 2 dosas only. For some people, it is only 1 dosa. So that is how the difference comes. But the whole point is, when the sleep is not proper, or when your physical activity is not proper, or when your hormones productions are not proper happening, the ghrelin and leptin hormone gets produced as they want, and the leptin becomes very high in production. You start eating more and the ghrelin hormone is left off. So there will be a problem if leptin is high and ghrelin is low, or leptin is low and ghrelin is high. So it should be balanced. So how it gets balanced is, you have to make sure that you add good amount of fiber, you add good amount of protein to your diet, less carbohydrates, practice training. This is what your body needs. So that's how when ghrelin increases, your appetite also increases. So both leptin and ghrelin are hunger and satiety hormones. Clear? Okay. Next one is growth hormone. We all have growth hormones in our body. Many people wonder, there is also this phenomenon called as dawn phenomena, which happens early in the morning from 3 a.m. to 8 a.m. or in between 8 a.m., 3 a.m. to 9 a.m. In between this, they see their fasting levels to be high, but post-lunch levels should be very normal. This happens to most of you people, and you might be wondering why and how. Because all these hormones like cortisol, growth hormone, adrenaline, these are the hormones that gets produced early in the morning in our body, because our body knows that, okay, this person is going to get up, he's going to brush his teeth, he's going to take a bath. So the body is now ready. ఓకే, ఒక పర్సన్ పొద్దున్నే లేస్తారు, బ్రష్ చేస్తారు, స్నానం చేస్తారు. సో కార్టిసాల్, గ్రోత్ హార్మోన్, అడ్రినలిన్, ఇవన్నీ మన బాడీలోకి ఇలా వెంటనే రష్ చేస్తాయి. సో బికాస్ బ్రెయిన్ తెలుసు, ఓకే, దిస్ పర్సన్ ఈస్ గోయింగ్ టు గెట్ అప్ రైట్ నౌ అండ్ డూ హిస్ డైలీ చోర్స్. సో రోజు లేచి ఈ పని చేస్తారని తెలుసు. దట్స్ ద రీజన్ ఆ హార్మోన్స్ అన్ని బాడీలోకి వస్తాయి. అయితే సో the importance of maintaining sleep over the night is very important, because sleep సరిగ్గా లేకపోతే your sugar levels in the blood automatically rises because of all the hormones that we are discussing right now, and already sugars are already high in your blood. On top of it, the other 3 hormones like cortisol, growth hormone, adrenaline comes and takes effective, and then again addition of sugar levels happens. That's the reason your fasting levels are always high. So there are many reasons to it. Your stress, your sleep, late night meals, more grains in the dinner. అంటే రాత్రిపూట తీసుకునే ఆహారంలో గ్రెయిన్స్ అంటే ధాన్యాలు, చిరుధాన్యాలు కానీ, లేకపోతే నార్మల్ ధాన్యాలు కానీ, రైస్ కానీ, రోటీస్ కానీ, వీట్ కానీ, ఇవన్నీ ఎక్కువ తీసుకుంటే డెఫినెట్గా అవి మళ్ళీ ఫాస్టింగ్ లెవెల్స్ మీద చూపిస్తాయి షుగర్స్ ఎఫెక్ట్. సో వీటిని మనం కొంచెం తగ్గించుకోగలిగితే, మిగతా వాటిని ఇంప్రూవ్ చేసుకోగలిగితే, definitely your fasting level slowly comes down. So growth hormone decrease అయిపోతుంది స్లీప్ సరిగ్గా లేకపోతే, మజిల్ రిపేర్ కష్టం అవుతుంది, ఫ్యాట్ అక్యుములేషన్ ఎక్కువైపోతుంది. సో that's how losing weight is difficult for few people. Losing weight or losing sugars or reducing sugars for few people is very difficult because of these issues. Because muscle repair proper ga untene, if the muscle repair is proper, then only your sugar starts coming down, then only the effect of insulin is good onto your body, then only your appetite, then only your hunger, then only your blood glucose levels all gets better. So what are those sleep disorders that are happening in diabetes people, or people who are obese or overweight, or people who are PCOS? One thing is, for in men and women, most of them have OSA, which is called as obstructive sleep apnea. And they get snoring, And because of snoring, the brain can't get enough amount of oxygen and it can't properly work, and the hormones can't properly get produced. That's one of the thing, and it is very common in overweight and obese patients. Next is restless leg syndrome. For few people, the leg pain is more at night, and then it just what do you say? Uh, uh, the nerves in the leg starts paining in them. And also, for many of you might have observed frequent urination at night. This is called nocturia. Nighttime urination becomes very high. Nighttime urination chala ekku untundi. And also, for some people, there will be a lot of pain in the legs, which is called peripheral neuropathy. You might have observed. So that peripheral neuropathy is what you need to make sure that it needs to be taken care of. So you have to meet your doctor. That's the reason complication screening is to be done every 6 months once, to make sure that your nerves in your feet are proper. Do you know that the calf muscles in our legs are called the second heart? Why is it called second heart? Is because మన కాలంలో మన పిక్కలు ఏవైతే ఉంటాయో వాటిని సెకండ్ హార్ట్ అంటాం. ఎందుకు అంటే మన బ్రెయిన్ దగ్గర నుంచి ఫీట్ వరకు వెళ్ళే బ్లడ్ మళ్ళీ ఫీట్ నుంచి మళ్ళీ హార్ట్ వరకు రావాలి. సో ఫ్రమ్ ఫీట్ ది బ్లడ్ హ్యాస్ టు రైజ్ అగైన్ టు ద హార్ట్ అండ్ ఇట్ హ్యాస్ టు గెట్ పంప్ టు ద హార్ట్ బ్యాక్, and this is done by the calf muscles. And that's the reason importance of walking and workout for your calf muscles is very important. Then only the amount of the impure blood that gets collected in the legs gets pumped to the heart, and then it gets again purified. So that's the reason many people who work as teachers, many people who work in like a lot of fields where they stand for longer times, get issues like varicose veins and all, because the impure blood gets trapped in the legs, and then it causes the varicose veins, because that has to be carried out to the blood, to the heart, and then there it should be get purified. Adi jaragadu. జరగకపోవడం వల్ల చాలా మందికి ఆ వెరికోస్ వెయిన్స్ ఇష్యూస్ వస్తాయి. Few blocks in the veins and nerves. So this causes lot of discomfort at night. రాత్రి పూట ఇది చాలా డిస్కంఫర్ట్ క్రియేట్ చేస్తుంది, and that is the reason for many people to suffer. And they sometimes they think that it is the work that they did, or it is because of the car they have driven, or it is the long distance they have done. Maybe the reason might be a little bit, but the main reason might be this also. So that's the reason it has to be checked. So morning glucose spikes, the dawn phenomena, cortisol, glucagon, growth hormone. So glucagon is nothing but the glucose stored in the excess glucose stored in your liver. So that's the reason the carbohydrate should be balanced. If you eat more carbohydrates, what happens is extra glucose that is not utilized by your body, or that can't be managed by the body, gets stored in the liver. So liver lo store అయిపోతుంది. So liver lo store అయిపోవడం వల్ల glucagon కింద store అవుతుంది, and that's the reason your liver function also starts coming down. So that's the reason many people say, sir, I didn't eat anything, but still my sugars are increasing. Why? I just drank water, still my sugars are becoming high. Sir, I didn't eat anything for my dinner, still my sugar levels are high. Why? Because of the glucagon. Because the stored glucose in your liver is high, and that's the reason the liver also produces the excess sugars into the blood again, and your sugar levels increases. So poor sleep can exaggerate this effect. Poor sleep, poor physical activity, sedentary life, stress, all of this increases the rise of glucose levels, because this is what it happens when you see the dawn phenomenon. Dawn is DAWN, dawn, which means in the morning. And also, if you see, many people might be wearing CGMS right now. So yesterday night, if you have had nice sleep, you see good amount of sugar levels, variability in your CGMS.
Ryan, hold it now.
if you see the reduced time in range, the TIR, the target in range, if you see the CGMS report, if that was sent to you, the time in range, the target in range is green color, and that is very high. It means like your sleep is good. And that is reduced, it means like your sleep is less. So it impacts that. So I'll show you something. I'll show you one example how that affects. I'll show you one example. Just give me a second. Okay, can you all see my screen? I'm just trying to share. Just a second. Can you all see my screen?
Not yet. It started sharing, but we can't see. Yeah, we can see now.
Okay. So the target range is what it says, which is called time in ranges. Okay. So this green area is what it depicts that the sugars are well controlled, and 7% is high. It means it is in between 180 and 250, and above 250 is in orange color. So yellow and oranges are high and very high. So some percentage was maintained at this point of time, where it means certain amount of time it is very high, and most in 24 hours. It is calculated in 24 hours, and a 24 hours format lo calculate cheskunte 21 hours the sugars are in range. 2 hours to 3 hours the sugars went here and there. So what time it went here and there, I'll also show you that.
Can we generate these reports in the app, CGM app?
You can't generate, sir, but we can generate it at the end and we can share it to you.
Okay.
It actually happens in that way.
It comes in the app also. Time
Yeah,
in
you can see the daily graph, but you can't see a cumulative report.
Yeah, it is there 7 days, 14 days, 30 days, 90 days, you can see.
Yeah, but this sort of results only happens from our end, sir.
Oh.
We gave that, but yeah. Okay, so now are you able to see this?
Yeah.
Okay, so if you see initial day one on Friday, the sugars are like very high. The yellow range is very high. So you see this graph, the 95th percentile here. The sugars are above the green line, but there is only one line that is above it, and the sugars were very high. And after that, you see the sugars are always in the range. So the gray area, this gray area depicts balance of sugars levels. If the sugars are controlled, it stays in this gray area. మీ షుగర్స్ కనుక కంట్రోల్లో ఉంటే ఈ సిజిఎంఎస్లో ఈ గ్రే ఏరియాలో ఉంటాయి. దిస్ ఇస్ ద గ్రే ఏరియా. ఓకే, సో ఈ గ్రే ఏరియాలో ఉంటే షుగర్స్ కంట్రోల్లో ఉన్నట్టు. అండ్ ఇఫ్ యూ సీ ది ఫస్ట్ డే వాజ్ లిటిల్ బిట్ హియర్ అండ్ దేర్, but if you see the timings of sleeping time, so for example, let's say 12 a.m. to 6 a.m., so the sugars were very high. So there might be some disturbance in sleep because It is the first day that you went to doctor. Doctor said that, okay, your sugars will be controlled because you might be on insulin, you might be on medications, you are worried about your health, and your sleep is disturbed, so the high sugars. But later on, when diet started, physical activity started, your glucose level started getting better, your sleep started getting better, and your sugar level started to make sense, and it is all okay. So 12 a.m. to 6 a.m. generally is our sleep time, and 3 a.m. to 8 a.m. is where we are talking about the dawn phenomena. Okay, so these small spikes, this this rise in your sugars is because you're not eating anything here, but your sugars are still going up. This is because of the three hormones that we are discussing: glucagon, growth hormone, and cortisol. ఓకే, ఆ త్రీ హార్మోన్స్ ఇక్కడ పెరగటం వల్ల ఇక్కడ చిన్న రైస్ జరుగుతుంది చూడండి. దిస్ ఇస్ హౌ ఇట్ ఇస్. ఓకే, సో దట్స్ హౌ ఇట్ ఇస్. సో poor sleep, poor, poor sleep and stress at night is what you need to avoid. So how do you address that? What are the tips that I would like to give you today? Simple tips to improve your sleep and glucose control. Do this exercise which we did at the beginning before sleep. Just keep all your gadgets aside, not in your bedroom. All your blue light emitting gadgets to be put aside. Set a fixed bedtime. Body needs rhythm. If your body can get that rhythm, it can start getting better. Avoid screens at least 1 hour before your sleep, because blue light blocks the metabolism. సో మనం ఏం పని చేయాలనుకున్నా ఆ బ్లూ లైట్ ఎఫెక్ట్ వల్ల మన మెటబాలిజం బ్లాక్ అయిపోతుంది. You have to practice these calming routines. So whenever your stress is becoming high, you should do this technique: some meditation, some calm breathing, some reading, some stretching. So at least some stretching like this. Whenever you're stretched out, like this. Okay, just do these sort of stresses. Get up, make your hands wiggle, and make your body wiggle, like you just make your body free, because till then your body is sedentary, it is not moving, only your fingers are moving on your keyboard and your body's restricted movements. So you have to make your body a little bit lighter, and especially avoid heavy meals and caffeine at night. You have to reduce caffeine as much as possible, because caffeine triggers cortisol levels. When caffeine triggers cortisol levels, you see your CGMS reading to be pretty high. There will be high spikes and low, very high crashes. So do we have Dr. Anil in the session? Dr. Anil? Anyone who has experienced that reducing caffeine has gave them positive results, they can speak about it.
Yeah, I've observed it in my life. I is Vapiraju. I
Yeah.
have recently been diagnosed, as you are aware, and I've been recently shown great progress. Told that I've been showing great progress as well. What difference I had in my life is, usually I was a heavy coffee drinker previously.
Yeah.
I gave up on my caffeine, and it has really showed the result. Thanks
Yeah.
for that.
Good.
No, sir, can you explain that, sir? I can't understand that caffeine part. Where to?
So caffeine generally triggers cortisol levels.
Okay.
When you consume caffeine, it increases the cortisol levels, and generally our sugars will be like a wave. After breakfast it will be a wave, after lunch it will be a wave, after dinner it will be like a wave.
Okay.
How the ocean's wave is, right?
Yeah.
So whenever this happens, when you're adding caffeine to that,
Okay.
the cortisol again increases. It's a hormone, and this triggers spikes in the sugar levels, and there will be, instead of wave, there will be an ECG graph. You know how
we should not drink coffee at all, or
see, it's not about not drinking coffee at all. If you get habituated to it, and if you have at least 2 or 3 times in a day, that is definitely going to affect your sugars. If you reduce the frequency, if you reduce the amount of caffeine, and if you drink it not on a fixed time every day, that is definitely going to create a positive impact on your sugars.
So you mean to say leaving coffee is a better thing?
Yes, to be frank.
Okay.
Yeah.
Okay, sir. Thank you.
Thank you. Right. Next, you should always create a sleep-friendly bedroom. Cool, dark, quiet. So bedroom is just to sleep, have your stress levels calm down. It should be, filled with nice, at least some flowers so that you can have that aroma, and then it cools down your hormones, and it reduces the stress. So whichever you feel, whichever makes you happy, your bedroom should be in that way. Cool, dark, and quiet. Reduce your nighttime fluid intake and salt intake to prevent nocturia. At night, make sure you have lesser salts. So at night, you prepare your meals with rock salt. In the morning, you can prepare your meals with normal salt or pink salt at night or rock salt at night, and reduce your nighttime fluid. Don't drink more than 200 ml of water after your dinner meals. And if your neuropathy is disturbing you, please address it. See the doctor and get it addressed as soon as possible. The restless leg syndrome, peripheral neuropathy is what affects your sleep as well. And if that is being fixed, definitely your sleep gets fixed and your sugar levels gets fixed. మీకు రెస్ట్లెస్ లెగ్ సిండ్రోమ్ ఉన్నా లేకపోతే పెరిఫరల్ న్యూరోపతి కాళ్ళలో నొప్పులున్నా పిక్కలు నొప్పెడుతున్నా దాన్ని ఫస్ట్ అడ్రస్ చేయండి, ఆ నొప్పులు తగ్గించుకోండి, మీ స్లీప్ని బెటర్ చేసుకోండి, షుగర్ లెవెల్స్ ఆటోమేటిక్గా డౌన్ అవుతాయి.
What about shoulder pain, doctor?
Yeah, shoulder pain, if it is a frozen shoulder or something, you need to take care of it. You need to get treated with our physio because you're in D360. So people who are in D360 get it treated out as soon as possible and then get it fixed. It will definitely impact. Any pains in our body increases the cortisol levels because it's a stress hormone. We are being stressed because pain is bothering me. So whenever the pain is more, you definitely get to see that your sugar levels or your cortisol levels rising up, and you see that your sugars fluctuate all the time. So you have to make sure about it.
Okay, doctor.
Okay. So the main take-home messages today in this discussion is about your sleep influences hormones that control sugars. Insulin resistance becomes more. Your cycles gets affected for women. Your sleep cycles get affected for everyone, because poor sleep is poor sugar control regardless of diet or medications. You do good diet, you do good take medications, if your sleep is not better, still sugar levels increases. You might be thinking like, I'm using the best medication, I'm taking insulin, I'm taking high units of insulin, why my sugars are not coming down? I'm taking very good detailing about my diet, still my sugars are down. Check on your sleep, check on your stress, because improving sleep is a therapeutic goal in your diabetes care, in your weight management. Sleep improvement is the only solution. మీ స్లీప్ ని మీరు ఇంప్రూవ్ చేసుకుంటేనే మీకు ఆ సొల్యూషన్ వస్తుంది. So yeah, we're open to discussion. You can always ask your doubts one by one.
Yeah.
I'll take the queries.
Sir, normally, how many hours is there any measure for sleep, or the satisfaction levels only?
Yeah, see, point is, as I said in the beginning, sleep is your reset button. Okay, so the reset button for everyone is different. See, for me, if I sleep 6 to 7 hours, it might be enough for me. For you, if you sleep 8 hours, it is enough for you. For some people, it is only 5 to 6 hours. So you need to sort it out by yourself, that sleeping, okay, this much of time, you observe it for a week, sleep for 7 hours minimum, see if your sugars are getting better. Next week, sleep for 8 hours sleep, and you see if your sugars are getting better. Which one is better for you? You just decide about it. So it is different for everyone. So there is no prescription sleep for everyone, like 8 hours. If that is the case, if 8 hours we are sleeping in our life, 1/3 of our life we are sleeping all the time. So it depends upon your work, it depends upon your stress, it depends upon your physical activity. Maybe you're working more, you have to sleep more. If your physical activity is medium, you can have 7 to 6 to 7 hours of sleep, that should be fine. If your physical activity is more, if your brain work is more, if you're sitting more in front of system, you have to have power naps in between every now and then, which also makes your cortisol levels to come down. సో మీరు పడుకున్నప్పుడు కంపల్సరీగా మీ షుగర్ లెవెల్స్ని కంట్రోల్ చేసుకోవాలి అంటే కనుక ఆ స్ట్రెస్ లెవెల్స్ని మనం తగ్గించుకోవాలి అంటే డెఫినెట్గా మనం ఇలాంటి టెక్నిక్స్ అన్ని ఫాలో అవ్వాలి. సో ఆ 8 hours ఆఫ్ స్లీప్, 7 hours ఆఫ్ స్లీప్, ఇట్ కెన్ వేరీ ఇన్ బిట్వీన్ 6 hours to 8 hours. 6 గంటల నుంచి 8 గంటల మధ్యలో వేరీ అవ్వచ్చు, ప్రాబ్లం లేదు.
Walking after dinner, somebody says that will control sugar levels. So is it correct or not?
Yes, definitely. Because see, walking for some time after dinner makes your insulin produce more, and then sugar level starts getting better. So because your pancreas is working, and because beta cells production is good, and beta cells working model is good, the insulin production will be good, and insulin resistance will be less. That's the reason post dinner, if you go for a walk, definitely your sugars will come down.
My last question. Normally, after eating lunch or dinner, after maybe 1 or 2 hours, the sugar levels are spiking up. Not immediately.
Sir, come again. When is it spiking up?
No, after food, maybe after lunch, maybe after 2 hours after lunch, the sugar levels are spiking up. So walking immediately after dinner or after maybe lunch is better, or maybe leaving a gap of 1 hour and then walking will be better.
So give a gap of at least half an hour and then walk. That should be good.
Okay.
Minimum is half an hour. Yeah. Yes.
Hey,
So someone said, like, do we have to change the routine timings for coffee? Yes, you have to change the routine timings of your coffee. Don't take it on the same time. Don't take it అంటే రోజు ఒకే టైంలో తీసుకోవద్దు, రోజు కాఫీ తీసుకోవద్దు, అండ్ నెగిటివ్ సిచ్యువేషన్లో అసలు తీసుకోవద్దు. సో వాట్ ఈస్ మెన్ బై నెగిటివ్ సిచ్యువేషన్ ఇస్ వెన్ ఆర్ యూర్ స్ట్రెస్డ్ అవుట్, వెన్ ఆర్ యూర్ నాట్ స్లీపింగ్ వెల్, డోంట్ డ్రింక్ కాఫీ అట్ ఆల్, బికాస్ it worsens the situation. Yeah.
hey, Gautam, a question on the CGM reading versus the glucometer reading. So after my 14 days, I see the glucometer readings are a little higher.
So this is just a second.
This Pradeep.
Hi Pradeep. Hi.
Yeah, I was about to consult you, but I said during the glucometer readings, I looked at it like, immediate and then 2 hours later. So I was assuming that, the glucometer would be somewhere after it gets into blood, right? So how should we correlate this?
Yeah, see, one thing is we have to see the history of diabetes, okay, and how long it is being affected in your body and why is it increasing is, let's say for example, if your meal has got good amount of carbs, or it has got less fiber, definitely there will be a spike. So if you can give me an insight like how your meal was, I can definitely help you with that.
Okay, maybe I'll consult in detail. So I did note all, and I continue to note it in the fiber, the liver pro after expiry also, so that I can connect with the glucometer readings. Consult.
Yeah, we can sit 1-to-1 and we can discuss about it.
But is there a direct correlation, like what we get from CGM versus what would have been the blood glucose level at that point?
I didn't get your point.
I'm saying that the CGM reading is not exactly the blood glucose level, right? As it's taking from the body.
Yeah, CGM is a trend that gives you, because there will be a small lag between the glucometer readings and the CGMS readings, because CGMS takes the readings from your serum, the blood serum.
Yeah.
Okay, the glucometer is where we put blood directly into it. Okay.
Yeah. So is there any relation, like it's like a 2 hours behind, or it's
so it's
most
15
likely
to 20 minutes behind. It's just 15 to 20 minutes behind.
Okay, got it. Yeah, thanks.
Yeah.
Hey, good morning, Gautam. This is Archana.
Yeah, Archana.
I'm speaking on behalf of Srinivas. The question is the afternoon naps, post-lunch naps. So is that okay to do, like they say, after you have your lunch, immediately after the meal, if you take a nap, you shouldn't be doing it, or you should be doing it. So he's habituated to like a 20-minute or half an hour nap post-lunch. Is that okay to do, or?
See, I'll tell you the point. Sleeping immediately after lunch is a common habit for everyone, but what to say? It has its pros and cons if you do it as soon as possible. There might be some acid reflux or some heartburn because immediately you're sleeping and then body tries to produce a lot of gastric juices. Poor digestion and bloating also causes uh, not much better control on your sugars. Weight gain in the central area, sluggishness and brain fog. These are the things that generally happens. So that's the reason you need to give some gap, at least like half an hour to 45 minutes after, at least 1 hour, I can say. Then you can not like completely like flat surface left sleep. You can just recline position, like 45 degrees or recline. That way,
Okay.
person can sleep, so that the acid reflux is not happening. Not flat. I mean, flat sleep should not happen. You can sleep in a reclined position. That's much better.
Okay. Does it have any impact on his sugar levels?
Yes, definitely.
Okay.
Yeah.
Okay. Okay. Thank you.
Yeah. Next, please.
One question I have, Doctor Balaji here.
Hi,
So
Balaji.
after waking up, let's say sleep is broken, let's say at 5:30, 6 o'clock. But do we have to come out of the bed immediately, or can we, like, my body is not allowing me to come out immediately? Still, like, I am awake, but I still sleep in the bed for half an hour to 1 hour more and wake up at 7, something like that. Will that cause any impact on the sugar levels?
Sometimes, yes. Because as I said, early in the morning when you get up, your body is ready to gush all the hormones that are responsible for your body. And if you're delaying the habits that you have, let's say, for example, the routine that you have, the physical activity that you do, so if that is getting delayed every day, 15 minutes or 20 minutes later, here and there, so your body is unable to adjust to the regime. So if you have that proper regime, whenever you get up, you just sit for some time, do this breathing exercise, stretch out your body, and drink some water, hot water, and then start your day. This way, you can ease off your morning sluggishness. What you say, but batakan man epudaithe vidulchukuntamo, then your body starts regaining its consciousness. So that's what you need to do.
Yeah, but this also became a routine for me. Like half an hour to 1 hour, I still be in bed, and from that time, I habituated body to one routine like hot water, then
Yeah,
do
staying for
walking,
half an
then
hour is fine. Staying for half an hour is fine, but 1 hour is like pretty high.
okay.
Yeah.
Sir,
Next.
one question, sir. Again. So, if I am not wrong, in between your lecture, maybe advice you told that increasing muscle power will improve the situation of controlling the sugar level.
Yes.
So actually, recently I started going to gym also, maybe 2 years back, and in between there is a gap, sir. Again, I want to go to the gym, and I am at 61 years now.
Yeah.
So there is no other problems for me, and just the sugar levels I started, I think 9-10 months back. So now my 3 months average is around 6.8.
Oh wow.
So initially also it was 7.1 only, sir. They when started, it came down to 6.4, and now it is 6.8. So just started one that glucomate or 250 mg one tablet I have started morning and evening.
Right.
So the main question is that suppose if I started going gym again and taking some protein or something like that to improve the muscle strength, will it be okay, or will it be any adverse effect on the sugar?
Just take some whey protein or plant-based protein, whichever is suitable to your body. You can definitely take it, and it will definitely increase your muscle power, and then it will increase your, it will decrease your insulin resistance, because muscle cells are highly insulin sensitive. Okay. More muscle means better glucose uptake from the bloodstream with less insulin. So your insulin need not to be very high to control your sugars. Your muscle is becoming more, your glucose uptake will be high into your muscles, and that's how your sugar levels starts coming out of from blood, and then it gets into your muscle, and hence your sugar levels in your blood sugars are always low. I mean, controlled. So it helps reduce the insulin resistance, which is the main cause for our type 2 diabetes.
So going to gym and taking some protein is also good for that, right?
Yes. And it also, muscle also stores glucose in the form of glycogen. Okay. After workout, what happens is your muscle absorbs more glucose to refill this glycogen stores.
Okay.
Hence the reduced blood sugar levels.
Yeah. Thank you, sir.
Yeah. And that's the reason the sessions on strength training is happening, sir. In D360, you will eventually, because you recently joined, so the strength training is also part of D360, where Dr. Sirisha takes care of it, and then she trains you on how to improve your strength. And it's also called resistant training, strength training. So you have resistant bands, where this is where your muscle starts getting better. Next, please.
Uh,
Yeah, anyone can unmute them and can ask the doubts, please.
okay.
డాక్టర్ సార్ సుబ్బయ్య సార్
Subhaya garu చెప్పండి. Yeah.
ఇప్పుడు మీరు చెప్పారు కదా స్ట్రెస్ గా ఉన్నప్పుడు కాఫీ తీసుకోవద్దు, ఇట్ విల్ ఇంక్రీజెస్ ది ప్రాబ్లమ్.
Yes.
బై ద టైమ్ కెన్ వి టేక్ టీ ఆర్ గ్రీన్ టీ?
A green tea also has caffeine, Andy. You can take any herbal teas. Let's say, for example, warm kalonji water, like warm to chesina water gani, like jeera water, anything that we have spices like cloves, cardamoms, or elaichi, cinnamon. Ilanti detox drinks this coach apart from green tea, or any herbal tea is fine.
Herbal tea is okay.
Yeah.
Okay, thank you.
Yeah.
గౌతమ్ గారు, ఆల్కహాల్ ఎలా ఎఫెక్ట్ చేస్తుంది గ్లూకోజ్? లాంగ్ రన్ కాదు, జస్ట్ వెన్ టేకెన్ ఆన్ దట్ సెషన్ సపోజ్.
Yeah. See, generally, the effect of alcohol on glucose is, and the studies were limited, but yes, it has both lowering and rising effects. Depending upon the quantity, timing, and what you eat with it, it depends upon it. So liver prioritizes alcohol metabolism over glucose release. So అదేం బ్లాక్ చేస్తుందంటే గ్లూకోజ్ వాట్ యు సే గ్లూకోజ్ కొత్త గ్లూకోజ్ ప్రొడక్షన్ కి బ్లాక్ చేస్తుంది ఒక్కొక్కసారి, ఎస్పెషల్లీ ఇన్ ఫాస్టింగ్ అండ్ పోస్ట్ ఎక్సర్సైజ్ స్టేట్. బట్ ఇఫ్ యూ డ్రింక్ ఇట్ ఆన్ an empty stomach, it can lead to hypoglycemia even up to 12 to 24 hours later. That is one thing. And when generally alcohol increases blood sugar is when you have more very heavy drinks like beers, cocktails, breezers, liquors. ఇలాంటివన్నీ తీసుకున్నప్పుడు డెఫినెట్గా there will be high spike, because the carbohydrate containment is very high in this liquors, I can say. So beer and sweet wine definitely increases because it is high in carbs, like vodka, whiskey, and without mixers, that can lower your sugars. But it doesn't mean that I'm promoting that, but generally this is what the studies are. If taken without food, the vodkas and whiskeys will definitely lower your sugars. That is been evident in many of my patients. And cocktails have a lot of sugars in them. It increases because they have sugar mixes in them. And red wine or white wine, they are neutral to slight drip. Safer option to consume in moderation. Did you get my point?
Hello, sir. One question on my side. So I understand you suggested having power naps to, fill in any gaps that you might have in a single sleep, your overall sleep window. I don't get much time. I mean, at least I can have only a 6 hour window at the night. But can I mean, what would be the impact, if any, if I divide my sleep into windows? Is it as effective as sleeping in a bigger window, or it is always better to have sleep in a big window, or can we do these power naps to supplement our sleep cycle?
Yeah. So the bigger window is like, at least 6 to 8 hours depends upon a person's work schedule or physical activity regime. But as you ask me, if you also sleep for at least 20 minutes, like power nap, 15 to 20 minutes of power nap in between, like at least 1 or 2, depending upon your stress at work, it will definitely help you out. It's not about completely sleeping for 8 hours and not sleeping at all in between. If you feel like sleepy, you sleep. It's not a big deal. But sleep not more than 15-20 minutes. Maximum, give or take half an hour, not more than that. Yeah?
But Can we do that as a alternative to sleeping in the night, or can I have a shorter sleep cycle, say 5 hours in night, and then take an afternoon sleep,
If
something
you
like that?
think like 5 hours of sleep is good enough for you to sleep at longer windows and then it is not affecting your sleep quality, you can do 5 hours of sleep and then in between you can have this snooze kind of or power naps in between. Not a big deal. Yeah, you can do
Okay,
that.
perfect. Thank you.
Yeah, yeah. But you just need to observe it. See, I can say that you can sleep for 5 hours, but please see if 5 hours is working out for you or if it is not working. If it is not working, go for 6 hours and then try to sleep another 1 to 2 breaks of power naps in between, or sleep for 7 hours minimum. See, minimum I can say there should be at least 6 hours for everyone. Whatever their, irrespective of their work schedule, 6 hours is something apt. On top of it, it depends upon your body, your age, your work schedule, your work type, your body type. Okay.
Excellent.
Yeah.
Yeah,
This
sir,
is,
this is Swati.
yeah, hi Andy.
సార్ ఇది చిన్న బాబుకి ఇంకా 7 మంత్సే. సో,
Yeah.
నాకు నైట్ నిద్ర అనేది ఇంకా అంటే వాడి ఫీడింగ్ టైమ్ అవుతుంది. ఆయనకి 3.5 అవర్స్‌కి పట్టాలి పాలు. సో, ఎట్లా అంటే 3 అవర్స్ వరకు లేచుంటాడు. హాఫ్ అన్ అవర్ ముందు పడుకొనుంటాడు. నాకెట్లా అవుతుందంటే పొద్దున్నే ఆఫీస్ ఉంటుంది. పెద్దవాడికి స్కూల్ ఉంటుంది. ఖచ్చితంగా నేను తన కోసం లేవాలి రెడీ చేసి పంపించడానికి. సో, రాత్రి హార్డ్‌లీ ఒక 2 అవర్స్ పడుకుంటే మళ్ళీ లేవాలి. పాలు పట్టి బర్పింగ్ ఇచ్చి ఇదంతా అయ్యేసరికి మళ్ళీ 1 అవర్ గ్యాప్. మళ్ళీ పడుకోవటం. ఒక్కొక్క రోజు 4 అవర్స్, ఒక్కొక్క రోజు 5 అవర్స్. ఆ తర్వాత ఒకసారి వీడి స్కూల్ కోసం లేస్తే, దాని తర్వాత ఇంకా నా స్కెడ్యూల్, నా ఆఫీసు ఇంకా నాకిది కంటిన్యూస్ అయిపోతుంది. ఇంకా సెట్ అవ్వలేదు టైమింగ్స్ అదంతా. నాకు మార్నింగ్ బ్రేక్‌ఫాస్ట్ అవ్వట్లేదు తినడానికి. అండ్ లంచొచ్చేసరికి ఏమవుతుందంటే ఇంకా కంటిన్యూస్ సపోజ్ రాత్రి 8:30కి అట్లా డిన్నర్ చేశాననుకోండి 9కో ఒక్కసారి 10, 11 కూడా అయిపోతుంది డిన్నర్ నాకు లేట్ అయిపోతుంది. మళ్ళీ మార్నింగ్ 12 దాకా అంటే నేను ఆఫీస్ కోసం కూర్చొని అప్పుడు ప్లేట్‌లో పెట్టుకోవాల్సొస్తుంది. కుదరట్లేదు నాకు. మరి ఇట్లా ఒక 10 అవర్స్ స్ట్రెచ్ ఏం లేకుండా స్టమక్‌కి పర్వాలేదా? అండ్ ఐ డోంట్ ఫీల్ లైక్ ఈటింగ్ ఎందుకో నాకు బ్రేక్‌ఫాస్ట్ చేయబుద్ధి అవ్వట్లేదు. పా నేను కాఫీలు, టీలు నాకు అలవాటు లేదసలెప్పుడు.
Yeah.
ఆ
Yeah.
పాలేమో ఉత్తగా తాగబుద్ధి అవ్వట్లేదు.
Right.
ఆహ్, ఎక్కువ తినట్లే గానీ షుగర్ రీడింగ్స్ ఆహ్, మా 135 ఫాస్టింగ్, 135, 140, 125 అలా వస్తున్నాయి ఫాస్టింగ్.
Yeah.
ఒక్కసారి ఆ టెస్ట్ కూడా పడుకుంటే టెస్ట్ మిస్ అయిపోతుంది.
Yeah. So Swatika, it's not a big deal. Below 140 is absolutely fine, Andy. ఇప్పుడు మీరున్న సిచ్యువేషన్ లో బిలో 140 ఈజ్ అబ్సల్యూట్లీ ఫైన్, డోంట్ వరీ. పోస్ట్ లంచ్ 200 కన్నా ఎక్కువ కాకుండా చూసుకోండి చాలు.
ఓకే. అండ్ ఇంకొకటి నాకు ఒక్కొక్కసారి ఇట్లా ఆకలేసినట్టు అనిపిస్తుంది. ఒక 5, 10 సపోజ్ బాబుకి పాలు పడుతున్నాననుకోండి. ఆ గ్యాప్‌లో సడెన్‌గా ఆకలేసినట్టు అనిపిచ్చి ఇట్లా 5 మినిట్స్‌లోనే ఏదైనా తిందాంలే 10 మినిట్స్‌లో తాగేసి ఎవరికన్నా ఇంట్లో ఫ్యామిలీ ఉన్నారు. ఎవరికైనా బర్పింగ్ ఇచ్చి తిందాం అనే టైంకి ఇట్లా నీరసం అంటే పడిపోతానని కాదు కళ్ళు తిరిగి. కానీ ఇట్లా ఒళ్ళు అంతా ఇట్లా గుంజినట్టు ఒక్కసారి నాకు తెలీదు ఎట్లా చెప్పాలో. ఇట్లా మొత్తం ప్రాణం ఇట్లా గుంజినట్టు అయిపోతోంది. ఇంకా
Yeah.
చేతగానట్టు అయిపోతోంది. ఇంకా అవ్వదు, నా వల్ల అవ్వదు. ఏదో అయిపోతుంది నా బాడీకి. అట్లా ప్రెగ్నెన్సీలో అయింది నాకు యాక్చువల్‌గా. సెకండ్
Okay.
ప్రెగ్నెన్సీలో బాగా అయిందట్లా. అలా సడెన్‌గా వస్తుందనమాట. ఇంకా ఏదన్నా తినాలంటే హెవీ షుగర్ లాగా అంటే కొంచెం గ్లూకోజ్ ఏసుకోవడమో, అంటే చాక్లేట్ తినేయటమో, అట్లా తిన్న ఒక 10 మినిట్స్‌కి ఇంకా మళ్ళీ బాడీ సెట్ అవుతుంది.
ఓకే.
ఆహ్,
సో
ఏదన్నా
జనరల్‌గా ఏమవుతుందంటేనండి, బ్రెస్ట్ ఫీడింగ్ మదర్స్‌కి
లేదు. అసలు
అవడానికి
బ్రెస్ట్ ఫీడింగే లేదండి. పాలే రావట్లేదు. ఎందుకో ఫస్ట్ బాబుకి లేవు, ఈ బాబుకి లేవు. సో,
ఓకే.
అది కూడా లేదు. పోనీ నా బాడీలోంచి మిల్క్ ఎళ్తున్నాయి, నాదంతా పోతుంది అనుకోవడానికి కూడా లేదు.
ఓకే. జనరల్గా పోస్ట్ పార్టంలో పోస్ట్ పార్టంలో ఈ హార్మోన్స్ ఇంకా అడ్జస్ట్ అవుతూ ఉంటాయి మీ బాడీలో. సో అందుకనే ఇర్రెగ్యులర్ టైమ్స్లో మీకు ఆకలి వేయటము, హైపోగ్లైసిమియా అంటే షుగర్స్ సడన్గా డౌన్ అయ్యి మళ్ళీ సడన్గా అప్ అవుతుంది. సో ఆ టైంలో మీకు అలా నీరసంగా అనిపిస్తుంటుంది. సో పోస్ట్ మీల్ షుగర్ క్రాషెస్ అంటాం అనమాట. సో మీ ఏదో మీరు ఏం చేయాలంటే షార్ట్ ఫ్రీక్వెంట్ మీల్స్ మీద ఎక్కువ కాన్సన్ట్రేట్ చేయాలి. ఒకటేసారి ఎక్కువ తినకుండా, అలాగని ఒకటేసారి కంప్లీట్గా అవాయిడ్ చేయకుండా, సంథింగ్ ఇన్ లో క్వాంటిటీస్ ఏదో ఒకటి మీకు నచ్చింది. అట్లీస్ట్ సమ్ బటర్ మిల్క్, బ్రేక్ఫాస్ట్ మీరు ఏమి తీసుకోవాలంటే అట్లీస్ట్ సమ్ బటర్ మిల్క్ తీసుకోండి. అండ్ నట్స్ అండ్ సీడ్స్ పక్కన పెట్టుకోండి. మీరున్న విసినిటీలో బెడ్ పక్కన, లేకపోతే మీరు ఫీడింగ్ ఇచ్చే రూమ్లో కానీ ఎక్కడన్నా కూడా యూ మేక్ షూర్ దట్ యూ హ్యావ్ దిస్ నట్స్ అండ్ సీడ్స్. సో మీరు ఫీడింగ్ ఇస్తున్నప్పుడు బేబీకి దెన్ యూ కెన్ మంచ్ ఆన్ చేస్తూ మీరు ఇవ్వచ్చు. దట్స్ నాట్ ఎ బిగ్ డీల్. అండ్ సో హీల్ అవుట్ అంటే లైక్ బికాస్ ఇట్ మైట్ బి C-section for you, I think.
Yes.
సో డిలేడ్ హీలింగ్ డిలే అవడం వల్ల కూడా మిల్క్ ప్రొడక్షన్ రాదు సరిగ్గా. సో హీలింగ్ ఫాస్ట్గా ఉంటే షుగర్ బ్రెస్ట్ ఫీడింగ్ చేయొచ్చు. సో అంటే మిల్క్ ప్రొడక్షన్ బాగానే ఉంటుంది. సో పీనట్ బటర్ లైక్ ఒక టోస్ట్ పైన పీనట్ బటర్ పెట్టుకోవచ్చు, లేకపోతే యాపిల్ సమ్ రోస్టెడ్ మఖనా పెట్టుకోవచ్చు విత్ బటర్ మిల్క్. కొంచెం చిన్న గ్లాస్లో రాజ్యావ్ పెట్టుకోవచ్చు, ఓట్స్ పోరీజ్ పెట్టుకోవచ్చు. ఇట్లా చిన్న చిన్న ఈ స్నాక్స్ పెట్టుకోవచ్చు అనమాట మీరు. ఓకే
డాక్టర్ గారు, గుడ్ మార్నింగ్ అండి.
యా హాయ్ హాయ్.
నా క్వశ్చన్ ఏమంటే అండి, నాకు లంచ్ తర్వాత టైం ఉండదండి, క్లాసెస్ ఉంటాయి నెక్స్ట్ కంటిన్యూస్ గా.
యా
అప్పుడు నేను ఇమీడియట్ గా వాకింగ్ వెళ్ళొచ్చా అండి? నేను ఒక 20 minutes వెళ్తాను లంచ్ బ్రేక్ లో, అంటే లంచ్ వెంటనే వెళ్ళిపోతానండి. ఈజ్ ఇట్ ఓకే?
అట్లీస్ట్ మీరు ఒక 5-10 minutes కూర్చొని రిలాక్స్ అయిన తర్వాత వాకింగ్ వెళ్ళొచ్చండి. ఇమీడియట్గా అయితే వద్దు. యూ జస్ట్ నీడ్ టు బి రిలాక్స్డ్. సో యువర్ బాడీ, యువర్ హార్మోన్స్ నీడ్స్ టు బి రిలాక్స్డ్. యా రిలాక్స్ అయ్యి ఒక 10 minutes తర్వాత వెళ్ళినా కానీ పర్వాలేదు. యా
థ్యాంక్ యూ.
యా ఎనీ అదర్ డౌట్స్ అండి? ఎనీ అదర్ డౌట్స్? Okay, if no doubts, I'm going to end the session.